Hello everyone, Dr. James Whittaker here, and today I'm going to share with you 7 critical levels of penis warning signs that men over 50 absolutely cannot ignore. If you're experiencing any of these signs, they could be your body's early warning system alerting you to serious health problems that require immediate attention. What I'm about to share with you isn't meant to cause panic, but rather to empower you with knowledge that could literally save your life. Many men dismiss changes in their sexual health as normal aging. But the truth is that significant changes in penile function, appearance, or sensation often indicate underlying health conditions that can be treated successfully if caught early. The 7 levels I'm going to discuss range from early warning signs that indicate the need for lifestyle changes to emergency symptoms that require immediate medical attention. Understanding these levels and knowing when to take action could prevent serious complications including heart attacks, strokes, diabetes complications, and even certain cancers. By the end of this video, you'll know exactly what to look for, what each level means for your health, and most importantly, what action to take for each warning sign. This information could transform your health outcomes and potentially save your life. Understanding the penis as a health barometer. Before we dive into the specific warning levels, it's crucial to understand that your penis functions as a remarkably sensitive barometer for your overall health. The penis contains some of the smallest blood vessels in your body, typically only 1 to 2 millimeters in diameter, which makes it extremely sensitive to changes in circulation, hormone levels, and neurological function. Because penile function depends on healthy blood flow, proper nerve function, adequate hormone levels, and good overall health, problems in any of these areas often show up first in sexual function. This is why penile warning signs are so valuable. They can alert you to serious health problems years before they become obvious elsewhere in your body. The blood vessels that supply your penis are similar to those that supply your heart, brain, and other vital organs. When these vessels begin to show signs of damage or dysfunction in your penis, similar processes are likely occurring throughout your cardiovascular system. This connection explains why erectile dysfunction is now recognized by cardiologists as one of the earliest and most reliable predictors of future heart attacks and strokes. The same principle applies to other penile warning signs. They often represent the tip of the iceberg for more serious underlying health conditions. Level 1. Decreased morning erections. Let's start with Level 1. Which is often the earliest warning sign that many men experience, but unfortunately dismiss, a gradual decrease in morning erections. Healthy men of all ages, including those well into their 70s and 80s, should experience regular morning erections during REM sleep cycles. These nocturnal erections occur automatically during deep sleep when your brain reduces production of norepinephrine, a neurotransmitter that normally keeps penile blood vessels constricted. When this happens naturally during sleep, increased blood flow creates erections that indicate your cardiovascular and hormonal systems are functioning properly. If you've noticed that you rarely wake up with an erection anymore, this isn't just about sexual function. It's often an early sign of cardiovascular problems, hormonal decline, or other health issues that need attention. The gradual loss of morning erections often precedes more obvious cardiovascular symptoms by 2 to 5 years, making it an invaluable early warning system. Research shows that men who lose their morning erections have significantly higher risks of developing heart disease, diabetes complications, and other serious health conditions. This level requires lifestyle evaluation and possibly medical consultation to identify underlying causes like high blood pressure, diabetes, low testosterone, or early cardiovascular disease. Early intervention at this stage can often prevent progression to more serious levels. Level 2. Reduced sensitivity and pleasure. Level 2 involves a noticeable reduction in penile sensitivity and sexual pleasure. This goes beyond just difficulty achieving erections. It's about the quality of sensations during sexual activity and the overall pleasure experience during intimate moments. Reduced sensitivity can indicate several underlying problems, including diabetic neuropathy, where high blood sugar levels damage the nerves that control sexual sensation, hormonal imbalances that affect nerve function and blood flow, medication side effects from common drugs like antidepressants or blood pressure medications, or circulation problems that reduce blood flow to sensitive panel tissues. This level is particularly concerning because it often indicates that nerve damage or circulation problems are progressing beyond what can be easily reversed. While level 1 changes might be addressed through lifestyle modifications, level 2 often requires more comprehensive medical evaluation and treatment. Men experiencing significant reduction in sensitivity should have comprehensive testing, including blood sugar evaluation, hormone level assessment, medication review, and cardiovascular screening. Early treatment can often halt progression and restore much of the lost function. Level 3. Difficulty achieving or maintaining erections. Level 3 represents the development of clear erectile dysfunction, difficulty achieving erections sufficient for sexual activity, or inability to maintain erections long enough for satisfactory intercourse. This is the level where most men finally seek medical attention, but ideally intervention should have occurred at earlier levels. Erectile dysfunction at this level indicates that the underlying health problems causing earlier warning signs have progressed to the point where they're significantly impacting function. This could represent advanced cardiovascular disease, significant hormonal deficiencies, diabetic complications, or other serious health conditions. What makes level 3 particularly concerning is the strong correlation with imminent cardiovascular events. Studies show that men who develop erectile dysfunction have dramatically increased risks of heart attacks and strokes within the following 2 to 5 years. The same atherosclerosis that blocks coronary arteries also affects the smaller penile arteries, but because penile arteries are smaller, they show symptoms first. By the time erectile dysfunction develops, significant cardiovascular disease is often already present and requires immediate evaluation and treatment. Level 3 requires comprehensive medical evaluation, including cardiovascular testing, hormone assessment, diabetes screening, and evaluation for other underlying conditions. Treatment at this level often requires a combination of lifestyle changes, medications, and addressing underlying health conditions. Before we continue with the more serious warning levels, I want to ask you to hit that subscribe button and ring the notification bell. The information I share on this channel about men's health warning signs has literally saved lives by helping men recognize serious problems early. Don't let pride or embarrassment prevent you from getting information that could save your life. Level 4. Changes in penis size or shape. Level 4 involves noticeable changes in the size, shape, or curvature of your penis, which can indicate serious underlying conditions that require immediate medical attention. These changes don't happen overnight. They typically develop gradually over months or years. The most common condition causing these changes is Peyronie's disease, where scar tissue or plaque forms inside the penis, causing curvature, shortening, and sometimes painful erections. While Peyronie's can sometimes be benign, it can also indicate underlying inflammation, autoimmune problems, or circulation issues that need treatment. Significant shrinkage of the penis, particularly when not erect, can indicate hormonal problems, circulation issues, or other health conditions that are affecting penile tissue health. This type of atrophy often suggests that underlying problems have been present for extended periods. Any new lumps, bumps, or areas of hardness in the penis should be evaluated immediately, as they could indicate serious conditions including penile cancer, which while rare, is more common in men over 50, especially those with certain risk factors. Changes in penile shape or size require prompt medical evaluation to determine the underlying cause and begin appropriate treatment. Early intervention can often prevent progression and may restore much of the normal anatomy and function. Level 5. Pain, burning, or persistent discomfort. Level 5 involves the development of pain, burning sensations, or persistent discomfort in the penis, which represents a significant escalation in warning signs that demands immediate medical attention. Pain during erections can indicate Peyronie's disease, infections, or other inflammatory conditions that can cause permanent damage if not treated promptly. This type of pain often worsens over time and can eventually make sexual activity impossible. Burning sensations, especially during urination or sexual activity, can indicate urinary tract infections, sexually transmitted infections, or other conditions that can cause serious complications if left untreated. In men over 50, these symptoms can also indicate prostate problems or other urological conditions. Persistent discomfort or aching in the penis, even when not sexually active, can indicate circulation problems, nerve damage, or other serious underlying conditions that require evaluation and treatment. Any type of persistent penile pain or discomfort in men over 50 should be evaluated immediately by a healthcare provider. These symptoms often indicate conditions that can cause permanent damage if not treated quickly, but that respond well to treatment when caught early. Level 6. Visible changes, discharge, or lesions. Level 6 represents visible changes to the penis that you can see, including unusual discharge, sores, lesions, or significant changes in skin color or texture. These are serious warning signs that require immediate medical evaluation. Any unusual discharge from the penis can indicate infections, including sexually transmitted infections, that can cause serious complications if untreated. In men over 50, discharge can also indicate prostate problems or other urological conditions that need prompt attention. Sores, lesions, or persistent areas of irritation that don't heal within a reasonable time period can indicate serious conditions, including penile cancer, which requires immediate evaluation and treatment for the best outcomes. Significant changes in skin color, such as persistent redness, unusual darkening, or areas of discoloration, can indicate circulation problems, infections, or other conditions that need medical evaluation. Any new growths, warts, or unusual bumps on the penis should be evaluated immediately, as they can indicate various conditions ranging from benign but treatable infections to more serious conditions that require prompt intervention. Level 6 symptoms require immediate medical evaluation, preferably by a urologist or other specialist familiar with penile conditions. Many of these conditions respond very well to treatment when caught early, but can cause serious complications if ignored. Let me share a compelling case study that illustrates how these warning levels progress in the importance of early intervention. Thomas, a 56-year-old business owner, came to me after experiencing several warning signs that he had been ignoring for over 2 years. Thomas's problems began at level 1. He gradually lost his morning erections over about 6 months. Rather than seeking evaluation, he dismissed this as normal aging and stress from work. His wife encouraged him to see a doctor, but Thomas felt embarrassed and hoped the problem would resolve on its own. Over the following year, Thomas progressed to level 2 with reduced sensitivity during sexual activity, then to level 3 with clear erectile dysfunction that was affecting his marriage. He also began experiencing level 4 changes with some curvature of his penis and what felt like a small lump. By the time Thomas finally sought help, he was experiencing level 5 symptoms with pain during attempts at sexual activity. He was terrified that he might have cancer and regretted waiting so long to get evaluated. When I evaluated Thomas, comprehensive testing revealed several underlying conditions that explained his progression through the warning levels. His blood work showed early diabetes with elevated blood sugar levels that had been damaging his nerves and blood vessels for years. His testosterone levels were significantly low, contributing to his sexual dysfunction and other symptoms. Cardiovascular testing revealed early atherosclerosis in his coronary arteries, confirming that his penile symptoms had been warning him about serious heart disease risk. The lump and curvature he was experiencing were diagnosed as early Peyronie's disease, likely triggered by the combination of hormonal problems, circulation issues, and minor trauma from attempting sexual activity with poor erections. Most concerning, his cardiac evaluation revealed that he was at high risk for a heart attack within the next few years if his cardiovascular health wasn't addressed immediately. His penile warning signs had been trying to alert him to this life-threatening condition for over 2 years. We implemented a comprehensive treatment plan that addressed his diabetes through diet, exercise, and medication, optimized his testosterone levels through hormone replacement therapy, began cardiovascular protection medications and lifestyle changes, and treated his Peyronie's disease with appropriate interventions. Thomas's response to comprehensive treatment was excellent, demonstrating how effective early intervention can be, even when warning signs have progressed to higher levels. Within 3 months, his blood sugar was well controlled, and his testosterone levels had normalized. His erectile function improved dramatically, progressing from complete inability to satisfactory function for both him and his wife. The pain associated with his Peyronie's disease resolved, and the curvature stabilized without further progression. Most importantly, his cardiovascular risk was significantly reduced through aggressive treatment of his underlying conditions. Follow-up testing showed improved blood flow and reduced inflammation throughout his cardiovascular system. Thomas's case demonstrates both the dangers of ignoring early warning signs and the potential for recovery when problems are finally addressed comprehensively. He often tells me that he wishes he had sought help at level 1, which would have prevented much of his suffering and health risks. I want to hear from you in the comments below. Have you experienced any of these warning levels? Are you currently dealing with changes in your sexual health that concern you? What's preventing you from seeking evaluation if you're experiencing these symptoms? Remember, discussing these issues openly is the first step toward protecting your health and potentially saving your life. Level 7. Emergency symptoms requiring immediate care. Level 7 represents emergency symptoms that require immediate medical attention, potentially even emergency room evaluation. These are situations where delays in treatment can result in permanent damage or life-threatening complications. A prolonged erection lasting more than 4 hours, called priapism, is a medical emergency. This can occur due to medications, blood disorders, or other causes, and can result in permanent erectile dysfunction if not treated immediately. Any erection lasting longer than 4 hours requires emergency medical care. Sudden, severe pain in the penis, especially if accompanied by swelling, discoloration, or inability to urinate, can indicate serious conditions that require immediate treatment. This could represent penile fracture, severe infections, or other emergency conditions. Complete inability to urinate, especially if accompanied by pain, swelling, or fever, requires immediate emergency care. This can indicate complete urinary obstruction, severe infections, or other life-threatening conditions. Any trauma to the penis that results in severe pain, significant swelling, unusual bending, or color changes requires immediate evaluation to prevent permanent damage. Sudden onset of severe erectile dysfunction, especially if accompanied by other symptoms like chest pain, shortness of breath, or neurological symptoms, can indicate serious cardiovascular or neurological emergencies requiring immediate care. Understanding these 7 levels of warning signs is most valuable when combined with proactive prevention and early intervention strategies. Regular self-examination and awareness of changes in your sexual health can help you catch problems at earlier, more treatable levels. Monthly self-examination should include checking for any lumps, bumps, or areas of unusual texture, noting any changes in size, shape, or curvature, observing skin color and texture changes, and paying attention to sensation and comfort levels. Lifestyle factors that support penile health include regular cardiovascular exercise to maintain good blood flow, healthy diet to prevent diabetes and cardiovascular disease, stress management to support hormone levels and circulation, adequate sleep for hormone production and recovery, and avoiding smoking and excessive alcohol consumption. Regular medical care becomes increasingly important after age 50, with annual checkups that include cardiovascular screening, diabetes testing, hormone level evaluation, and discussion of sexual health concerns. The key to successfully managing these warning signs is knowing when to seek professional help and not letting embarrassment delay necessary care. Level 1 symptoms warrant discussion with your primary care physician and lifestyle evaluation. Levels 2 and 3 require comprehensive medical evaluation, including possible referral to specialists like urologists or endocrinologists. These levels often indicate underlying conditions that need specific treatment. Levels 4 and 5 require prompt medical attention, preferably from specialists familiar with penile conditions. These symptoms often indicate conditions that can cause permanent damage if not treated quickly. Level 6 requires immediate medical evaluation, as visible changes can indicate serious conditions that respond best to early treatment. Level 7 represents medical emergencies requiring immediate care, often in emergency room settings. Treatment options vary depending on the underlying cause and the level of symptoms, but early intervention generally provides better outcomes with less invasive treatments. Level 1 symptoms often respond well to lifestyle modifications, exercise, stress management, and addressing underlying health conditions. Levels 2 and 3 may require medications, hormone optimization, treatment of underlying conditions like diabetes or cardiovascular disease, and sometimes more advanced therapies. Higher levels may require specialized treatments, surgical interventions, or emergency procedures. But even these often have good outcomes when addressed promptly and appropriately. Throughout all levels of penile warning signs, communication with your partner is crucial for both relationship health and medical care. Partners often notice changes before the affected person does and can provide valuable support in seeking appropriate care. Open communication about sexual health changes can strengthen relationships and ensure that both partners understand the medical nature of these problems rather than interpreting them as personal rejection or loss of attraction. Partners can also provide crucial support in lifestyle modifications, treatment compliance, and emotional support during evaluation and treatment processes. The long-term outlook for men who experience these warning signs depends heavily on how quickly they seek appropriate care and how comprehensively underlying conditions are addressed. Men who seek help at earlier levels generally have much better outcomes with less invasive treatments. Even men who have progressed to higher levels can often achieve significant improvement with appropriate treatment, as Thomas's case demonstrated. The key is not giving up hope, but rather seeking comprehensive evaluation and treatment from qualified healthcare providers. Many underlying conditions that cause these warning signs respond very well to treatment when addressed appropriately, often resulting in restoration of normal or near normal function and significant improvement in quality of life. The 7 levels of penis warning signs I've shared with you today represent a comprehensive framework for understanding when changes in your sexual health require attention and action. From level 1's decreased morning erections to level 7's emergency symptoms, each level provides important information about your overall health and the urgency of needed care. Thomas's case demonstrates both the risks of ignoring early warning signs and the potential for recovery when problems are addressed comprehensively. The key lesson is that early intervention at lower levels is always preferable to waiting until symptoms progress to higher, more serious levels. Remember that penile health is integral to your overall health, and changes in sexual function often indicate underlying conditions that affect your entire body. Don't let embarrassment or fear prevent you from seeking the evaluation and treatment you need. If you're experiencing any of these warning signs, take action appropriate to the level of your symptoms. Early levels require lifestyle evaluation and medical consultation, while higher levels require prompt or immediate medical attention. The most important message is that you don't have to accept declining sexual health as inevitable with aging. Most of the conditions that cause these warning signs can be treated effectively when addressed appropriately and promptly. If you found this information valuable and potentially life-saving, please hit that like button and share this video with other men who need to understand these critical warning signs. Subscribe and ring the notification bell so you don't miss future videos about men's health topics that could save your life or dramatically improve your quality of life. Take action today if you're experiencing any of these warning signs. Your health, your relationships, and potentially your life depend on recognizing these signals and responding appropriately. Thank you for watching, and remember, your body is trying to communicate with you through these warning signs. Listen to what it's telling you and take action to protect your health and vitality.